Welcome back to Masters on the Move. I'm your host, Justin Hill, and today we're exploring a topic that affects absolutely everyone, sleep. Joining me is Katrina Aubrey, a registered clinical sleep and respiratory physiology technician. Katrina has spent many years helping people understand their sleep patterns, manage sleep disorders, and find ways to rest and recover better, something that becomes even more important as we age. Today, we'll be talking about how sleep needs change with age, what we can do to improve and optimize our rest, and how things like exercise, diet, and lifestyle can make all the difference. Katrina, it's great to have you on the show. Welcome.
Oh, good morning, Justin. Thank you. It's an absolute pleasure to be here with you this morning.
Fantastic. Katrina, can you tell us a bit about your background and what a clinical sleep and respiratory physiology technician actually does?
Sure. So my background started in hospital-based respiratory and sleep clinics, where I was involved in testing, diagnosing, and then treating common sleep disorders such as sleep apnea or insomnia. And these days I work with a variety of organisations, individuals and professional drivers, helping them understand and manage fatigue to optimise their sleep and their health and performance.
Right. What drew you into specializing in sleep health?
Well, Justin, this is an interesting one. I worked shift work in hospitals for many years,
Yeah.
and I managed shift work completely fine into my 20s. But as soon as I hit my mid-30s and 2-under-2 came along, I reached a point where I realized I couldn't keep performing my job safely, uh, nor was I the parent or the partner I wanted to be. And my mental health was declining. So I was on a bit of a self-help progress, trying to find what I could do to capture myself before I worsened in my mental health. And I'd accidentally come across a shift and some training where I could now go to day shifts. So funny enough, I ended up working in an area of sleep health and medicine, which has been completely life-changing in not only my own physical and mental health, but just watching how life-changing it is for other patients. So I'm very passionate about finally finding that area of health that is really rewarding for myself.
How do our sleep patterns typically change as we get older?
Yeah, so as we age, our sleep tends to become lighter and more fragmented. We're going to spend less time in our beautiful deep sleep and those restorative stages, and now more time as we age in our lighter stages.
Right.
The body clock also shifts slightly earlier, so it means we're going to feel more sleepier towards the earlier end of the evening, but frustration for some, we're now going to wake up earlier in the morning as well.
Okay. So is it true that adults need less sleep, or is that just a myth?
No, as we age, our sleep tends to become lighter and more fragmented. So we do need to spend the same amount so we need about 7.5 hours of sleep as an adult. And so it is a myth. Older adults need roughly the same amount of hours as a younger adult. It just becomes a little bit harder to achieve that continuous block. So the challenge is maintaining good quality sleep and not so much the quantity. And the idea sometimes is if you can't get it in the full block, try catch up for an hour or two of the afternoon if you're able to.
Okay. Why do so many people report lighter and more broken sleep as they age?
Justin, there's going to be several reasons. We're going to have reduced melatonin production, changes in our hormones, medication can have a difference, pain as well for some of us, as well as those annoying bathroom visits.
Yeah.
The brain sleep architecture does naturally change as we age, and so the deep sleep becomes less dominant. And here we go again with that lighter sleep becoming a bit more dominant in that area. It doesn't mean that we're destined to have poor quality sleep as we age. It's really around having some research and some education in your own sleep hygiene, which can help promote some of that. So something like a regular bedtime, being aware of your body clock and that amazing natural sunlight, and just staying physically active is going to promote much deeper restful sleep.
Okay. What are some of the most common sleep issues that you see in middle-aged or older adults?
Yeah, the biggest one is insomnia. followed by sleep apnea. So insomnia is obviously when it takes you much longer to fall asleep, typically over 30 minutes.
Okay.
And the sleep apnea is a saying I like to use is do not ignore the snore, Justin. So there is snoring. If any of our listeners are out there listening to this, it is usually a form of sleep apnea. It's really good to find out how severe that sleep apnea might be. And also, sometimes we'll see a lot of restless leg syndrome with that sleep apnea as well. So, um, cutting out things like screen time before bed, and alcohol and caffeine, again, will help better sleep hygiene, which can also help with some of those more common sleep disorders. But again, it shouldn't be complicated. People should understand what's normal in their sleep and what is not. And certainly snoring can be normalized, but it's certainly not normal and it should always be looked into.
Okay. So how do conditions like that sleep apnea that you mentioned or restless leg syndrome affect the quality of life if it's left untreated?
Oh, it hugely affects people's lives. If sleep apnea is left untreated, you will find you're probably on blood pressure medication. We're going to have a lot more strain on your heart. Memory problems is another one because now your sleep quality is not there because you're waking up constantly to take a breath with those apneas. Weight gain is going to be there. I find nothing more frustrating people, coming to see me privately saying, I just can't shift this weight. It won't come off. And yet I'm pounding the pavement and eating nothing but fruit and vegetables. And your body will go into survival mode where it wants to store that fat because it needs it as energy source. So it becomes poor quality of life when you've got a sleep disorder, but you're not
Mm,
aware of it. And now you've got all these health implications coming from it. So it can drain
yeah.
your energy, your mood, your motivation, and especially if you really enjoy your active exercise or your training.
Right. You did touch on it briefly earlier about daytime naps. Are they helpful or harmful as we age?
Yes, no, they're helpful. So a short nap though, it's the timing. So a
Okay.
short nap of an afternoon, not you don't want to nap too close to bed because we burn off what's called adenosine, which is our sleep pressure.
Hmm.
But research has shown 15 to 20 minutes is a great energy boost. Something I recommend to a lot of my patients is the famous 26-minute NASA nap. So NASA spent a lot of money doing some research around astronauts and pilots, and they
Oh,
had found
yes.
that that 26-minute is spot on to bring you up to 2 to 3 hours of alertness after that nap.
Oh, wow.
As I've mentioned, it's the key is the timing. So if you nap past around the 35-minute mark, you're going to hit your deep sleep, which, as many of us will know,
Oh,
if you ever fall asleep too long of a nap, you're going to wake up feeling groggy, disoriented, and moody, wishing you probably didn't sleep at all in the afternoon. So
right.
by all means, you're more productive in the afternoon with a little afternoon siesta, but just limit it to under the 30 minutes. The 26-minute NASA nap is key.
Oh, that's great to know. What
Yeah.
are your top practical tips for creating a sleep friendly environment?
I touched a little bit already, Justin, on the sleep hygiene. I will keep singing to the cows come home about we must have 7.5 hours of sleep. It does not matter of your age unless we're talking about children. But
Hmm.
it's no good getting 7.5 or 10 hours of sleep if it's not good quality. So
Right.
where do we get the good quality from? It comes from your sleep hygiene, which refers to your bedtime routine, which means that we need to create a sleep-friendly environment. Cool, dark, and quiet. Think of your bedroom like a cave. Keep the technology out, invest in a good mattress and some pillows,
Yes.
and again, keep that consistent bedtime routine to give your brain that cue of when it knows now it needs to go to rest. Brain prefers routine. If you hop into bed and you've had everything jumbled up of that day, your brain will be thinking, what am I meant to do now? Is it sleeping or is it checking the work emails? So again, that sleep hygiene is really important.
Okay. How do these consistent bedtimes, light exposure, bedroom temperature, uh, how, how, how do they, why are they so important?
Well, they're foundational in having good quality sleep. So in the sleep world, as I've mentioned, we call it sleep hygiene.
Yes.
Light tells your body when you're awake or if
Okay.
it's dark. when to go to sleep. So having bright light when you first wake up in the morning is going to help sync your body clock, which prepares you now for your nighttime sleep all the way back then in the morning. At nighttime, we spend far too many light bulbs on in the house, and so you should be having the whole house should be dimmed, not only for children and other family members, but for yourself. Back in the cave days, once the sun went down, there was no more light. Our body clock started to recognize what we need to be doing soon, which is sleep. And obviously, the 18-degree bedroom temperature is ideal. In order for us to hit our beautiful deep sleep and stay in our deep sleep, we need to have a nice cool body temperature. And the only way you're going to get that is by having your bedroom kept nice and cool. And that can be obtained by, in the summertime, having those nice big thick blockout blinds and drawing them nice and early. So I'm in the habit, being back from Perth, where come 3 in the afternoon, as the sun starts to sort of come on its way down, start blocking up the house, shutting the house, and then once the sun's disappearing a bit, you open it back up and get it ventilated. So just being really mindful of what your bedroom temperature is and keeping that consistent low temperature goes a long way.
Mm. Are there any other small changes that people can make tonight that would improve their sleep straight away?
As I've briefly touched on, your screen time. So yes, there is research, as I'm sure a lot of the listeners have heard, in regard to the blue light. There is evidence to show that it will delay your melatonin, which is your sleepy hormone, but probably not to the length of time that people would think. What more recent research is showing is it's not necessarily the blue light that's causing the problem with the screen time. It is actually, what are you watching? Is it overstimulating? Because watching something where it's overstimulating, it's a thriller movie, your brain is doing lots of processing and thinking, it's very much alert. It's nowhere near sleepy. And I guess a bit of a joke I have with my patients when I'm running seminars these days is, one thing that works very well for me is watching something like Country Calendar. You've got the nice animals, the nice green paddocks,
Yes.
really load your mood down a bit, and definitely is a better thing to watch rather than something quite stimulating right before bed.
Right. That's interesting. So let's talk a little bit about exercise and how that affects sleep. Regular exercise, does it influence our sleep quality?
Definitely. Sleep medicine and sleep science is all about going back to basics and not having everything overcomplicated. Exercise is one of the best natural sleep aids. It helps you fall asleep faster. Research has shown this. It will boost your deep sleep, as I keep mentioning, because the deep sleep is beautiful physical health, and will improve your overall sleep quality. And again, if you're able to exercise on the same time most days, again, this is a cue for your body clock. Your body clock's understanding what time of the day is and just
Right.
syncing your body clock to now recognize again when it's going to be about bedtime.
Is there a better time of the day to exercise for better sleep?
Well, speaking of the body clock, which is our circadian rhythm, research has shown that athletes often perform best late in the afternoon between 4 and 6 p.m. due to our secondary circadian rise. And so this is to do with you get a bit more of another alertness come through, core temperature is going to climb, and then it will have a dip right before sleeping time. So physical performance, coordination and endurance will peak at these times. This is a great time to exercise. However, for those of us like myself that there's no way I could exercise at that time of the day, I actually prefer being out nice and early when the streets are still quiet. And again, you're still going to get the benefits there. You're still going to get the nice sync of the circadian rhythm with the natural sunlight. So, in my opinion, any exercise is always good exercise. The only thing I would say is do not be doing anything too strenuous past about that 6 p.m. because what you're going to do is heat up your core body temperature. And as I've mentioned a few times already, in order to get your deep sleep, your body temperature needs to drop. So if you're exercising or at the gym too close to bed, you're going to find you're going to get probably a bit of insomnia because your body's not able to sink into some nice deep sleep until it's cooled down.
Right. So avoid too much late night training because that will affect our sleep in a negative way.
Correct. Yeah.
So how do things like caffeine, alcohol, and late meals affect our sleep cycles?
Caffeine. I mean, it's most people's best friends. Now, it's the timing and the dose of caffeine that is the problem. So caffeine will linger in your system for about 6 to 8 hours. So
Mm-hmm.
an afternoon coffee will still be active in your brain at bedtime. You may be like my mother, who will say, I love a cup of coffee after dinner and I fall asleep perfectly fine. I'm not suggesting you can't sleep with caffeine. What caffeine will do is it's going to block your deep sleep and your
Right.
dream, your REM sleep by
Okay.
up to 30%. Now, for this to happen naturally, you've aged 10 years. So caffeine needs to have a cutoff time of 6 hours before bed. Alcohol needs a cutoff time of about 3 hours before sleep because, again, it's going to block those sleep stages, which mucks up your sleep architecture, which then what do you need to do when you first wake up in the morning to function? You need caffeine. You don't know why you woke up feeling a bit flat.
Mm.
But the reason is because you've blocked your sleep architecture, it's not performing as it should. So by having cutoff times for the caffeine and the alcohol really is going to be the big thing. And then obviously when we talk about heavy meals, we don't want anything heavy too close to bed. We want to just aid your digestion as you're sleeping. And so having something really light is going to be beneficial for your health system.
Mm. Okay. Are there specific foods or nutrients that actually support better sleep?
Yes, foods that are high in tryptophan. Now, you'll find foods that are high in tryptophan are along the line of cherry, your banana, nuts, seeds, shellfish. There's quite a few foods, so I recommend any of our listeners today to Google tryptophan. Now, tryptophan will almost mimic to some degree of our sleepy hormone melatonin. For a couple of years now, I've been recommending tart cherry as a supplement that you can buy at a pharmacy.
Yeah.
I don't take this myself at the moment, but again, particularly those we've got our active people that are actively, participating in sports and quite active late in the afternoon. They are finding by taking the tart cherry, it most definitely is aiding into some deeper sleep a lot
Right.
earlier on in the night. So I am hearing great feedback. So I do recommend again anything that's got tryptophan in it. It may be form of a supplement like a tart cherry, or it may be a bowl of cherries or a banana, but it's really going to help with your not only stabilize your blood sugars at night, but just help with that steady energy for a better night's sleep.
Yeah, cherries are delicious.
Yum.
What's your view on supplements like magnesium and melatonin?
Again, I'm one again. I don't like my health to be overcomplicated. Natural is best.
Yes.
Magnesium is something I do recommend. Magnesium can be very helpful, particularly for a lot of us who have low magnesium diet and you don't recognize it, just as a lot of us have a low protein diet and we don't recognize it. So melatonin will work as a supplement for jet lag or some of those that are doing shift changes of night shift and shift work. But magnesium's great. Melatonin, please be careful with, and I certainly don't recommend popping them in the little chewies that young children are having these days.
Okay. Yep.
They will help fix chronic sleep problems for those that need it. But it's always best to focus on your habits first before supplements.
Right. That's wise advice. For older runners and athletes, why is sleep so critical for recovery?
Because it's actually when your body does recover and rebuild. Sleep is the recovery phase for your muscle repair, your energy stores are replenished, you've got your growth hormones that are at their peak at sleeping time. So skipping again that quality sleep or the quantity, not getting enough sleep, it's like skipping your cool down or refuel or skipping the refueling after training,
Mm,
right? Like why would you put so much effort into your daytime, but then lack in the nighttime? It just doesn't make sense.
yeah. What happens at a cellular level during sleep that benefits training and performance?
So we're only going to get about 20% of deep sleep over our 7.5 hours of sleep. And our
Yeah.
deep sleep is the sleep that's going to release the growth hormones. It's going to
Right.
drive the tissue repair and the fat metabolism. And then we've got our 20% of our REM sleep, which is our rapid eye movement. That's going to support our mental recovery, our focus, and our motivation, which is equally as important. And so together they keep your performance sharp and I guess your risk of injury much lower too.
Right. Do you think that masters athletes have a unique sleep? Do they have unique sleep needs compared to the general population?
Um, I guess they have some needs, but often need to work harder to protect the sleep quality. Recovery time is obviously going to be a little bit longer with age. So again, prioritizing the good sleep hygiene. We're going to go back to basics here and
Mm,
have the rest days that you're going to need, and they're going to be equal as important. And I'm not a professional, athlete, and I certainly don't know a lot like your listeners would know. But it's not rocket science to understand if you're
yeah,
going to burn the candle at both ends, what are you actually achieving at the end of the day? I've just seen multiple people even that they've hung up their walking shoes or their exercise shoes at the gym for 2 days because their body needs that rest time for some of them, and
yeah,
they're losing weight and gaining more muscle because now they're getting the sleep that they need to gain the muscle and to lose the weight. Because if you're not sleeping well, you are going to gain weight because of a mix of leptin and ghrelin hormones. So again, honor your rest and enjoy your rest.
yeah. Absolutely crucial. I feel as we age, I've experienced it myself. So, yeah, I think it's absolutely important. At what point, Katrina, should someone seek professional help for their sleep problems?
I quite like the Garmin watch or the smartwatches we have these days. It's been very interesting to understand that the algorithm of these watches have improved to the point where if somebody's now recognizing that their watch is showing that a deep sleep's a little bit low or the REM sleep's a little bit low,
Yes.
they're not going to have the same algorithm as a diagnostic sleep test like the one that I would offer, which will pick up sleep apnea and a few other cardiac variations there. However, do take note. Ask your bed partner, do I kick and jerk in my sleep? Do I snore? Am I a side sleeper? Are you waking up after about a month and still feeling like you've improved sleep hygiene, but feeling like it's still impacting your mood or your focus or your performance? If that's the point, then yes, you need to get it checked. Just be self-aware of how you're feeling in the morning. You really should wake up like a box of birds. And my biggest challenge is trying to convince somebody. I'm very sure you've probably got sleep apnea. I really think we should have a look at that. And they will say to me, I wake up completely fine. Their fine has become their normal, but it's not been their thriving fine, where it can be once they've had good quality sleep from getting treated for a sleep disorder. So just pay attention. Definitely ask family members, ask questions, and understand what's normal in your sleep and what's not. And then please do see your GP and get some advice there. Or I'm more than happy for listeners to reach out and I can guide them along that system as well.
Okay. So, what's actually involved in a sleep study or assessment?
Yeah, so sleep studies can be performed in a hospital, what we'd call a polysomnography or a PSG. This is really helpful for a lot of other sleep conditions, but if we're generally just wanting to look at your respiratory and cardiac health, particularly thinking that there could be some insomnia, or we're wanting to look at your sleep stages to make sure you are getting enough of the right amount of those sleep stages. I offer, and I'm sure other people can find other clinics that will offer home sleep tests. And so you will wear a little device for one night's sleep in your own bed, and the algorithm is very clever at detecting if something's there or not. And they're so accurate that in actual fact, if we were to do the test in a week's or a month's time, it's going to come back about the same still. So again, I would look at a sleep test like a prostate check or a breast check. It's one of those health checks that is the best time to see your cardiac health and your respiratory health is by when you're asleep. And particularly with a device like the one that I use, which is called a level 3 device, and it's very accurate and it's looking at a few different channels. So look at it as any other health check that we should be having from time to time.
Yeah, right. Yeah, and I've done one of those tests thanks to you, and it's very interesting. And I was concerned that it would get in the way because you're wearing this device, but it was quite easy and it's quite straightforward to do.
Yeah.
Are there treatments or interventions that make a real difference for persistent issues?
Yes, so sleep apnea is very common, as I've mentioned before. So CPAP therapy, which is a little breathing machine, very, very common. So again, I'm sure a lot of listeners would already understand what a CPAP is. It's a little breathing machine that you'd have in your little side table there. But depending on how severe you are, you may need something that we'd call a mandibular advancement splint, which is a little dentist-made mouth guard that brings your lower jaw forward a little bit. That's going to bring some nice tension into your airways to keep them nice and open. I really urge listeners to not go and try find a quick, cheap fix like in a chemist, because they're not, number one, they're going to buckle your teeth, and number two, they're not going to give you the result that you need. So CPAP therapy is great. Mandibular advancement therapy is great. The amount of people that I've referred on to ENT because they've had large tonsils or a nasal polyp, or it's an upper airway problem that needs to be looked at. So, and then we've got something like the restless legs, which can be an iron deficiency, or it can be sometimes piggybacking with obstructive sleep apnea. So a few different treatments. And as I've mentioned, 10, 15 years ago, machines were big, therapy was big. The technology that's coming around these days and things that have been developed to help treat the likes of sleep apnea is not really invasive as like it used to be.
Right. Katrina, if you could give one piece of advice to older adults who want to protect their sleep health, what would that be?
Treat sleep as your third pillar of health, right alongside diet and exercise.
Right.
It's not a luxury, it's a performance tool. And protect it the same way you're protecting your training schedule, that non-negotiable 7+ hours of sleep. You are better off to get more sleep and less kilometres, in my opinion. So protect that. Again, be aware of, is there anything you're doing at your bedtime routine that may be causing some less hours in sleep or poor sleep quality?
Right. Katrina, where can listeners find out more about healthy sleep practices or connect with you?
Sure. So I'm currently working as a fatigue consultant with AutoSense. And so viewers are able to go to the AutoSense website here in New Zealand, and you can contact me that way. Or I'm more than happy for people to reach out at KAT, K-A-T, at autosense.co.nz. And I'm more than happy to keep, again, answering any questions. It'd be an honour to help bring some education and awareness for any age person that just needs a little bit of help with understanding what they need for sleep.
Thank you very much for being so willing to help and let people reach out to you. I'll put those links that you mentioned in the show notes as well so people can find it there. Is there anything else that you feel you'd like to share with people that I maybe haven't asked?
I think going back to I'm waking up not feeling my best in the morning because I'm busy, because I'm a parent, because I'm getting old. Do not use your age as an excuse to not wake up feeling your best. And I genuinely say this because I was in my 30s and not waking up my best. And I just thought it was because I was a mum with 2 under 2. You should be waking up refreshed. You can't be pouring from an empty cup. So pour your own cup first. Take your own health and well-being serious. Put yourself as number one. Then you're going to be the best partner, the best parent, the best colleague as number 2. And it was life-changing for myself. And I see it change people's lives every day. So look after yourself as number one first so you can be the best for those around you.
So true. Katrina, thank you so much for joining me today. That was a fascinating and really practical conversation. You've given us so much to think about when it comes to looking after our sleep and, by extension, our overall health. Just a quick reminder for listeners, what we've talked about today is for general information and education only. If you're having ongoing issues with sleep or other health concerns, it's always best to seek advice from a qualified healthcare professional. Katrina, thanks again for your time and your expertise.
Thank you.
It's been a real pleasure having you on Masters on the Move. And to everyone listening, thanks for tuning in. Until next time, keep active, stay healthy, and remember, it's never too late to chase new goals.